First off, we'd like to welcome everybody to our second SAMPS virtual networking meeting. My name is Alan Kovacic. I'm the host, and I'm also the communications director for SAMPS. We're really honored to have Dr. Lucier here tonight. We had this presentation on the books, and we had it all organized in March of last year. And then at the end of it, or just at the last minute, we did have to cancel because of the COVID restrictions that were happening. So, we're just so thrilled that we can have this, albeit a little bit late, or a little few months down the road. I'll get Deet Adam, our intrepid leader, to give the formal introduction for Dr. Lucier. But we'd like to attend to a few housekeeping items first off. Firstly, I would like to welcome anybody or any visitors to this presentation that are maybe not SAMPS members or familiar with SAMPS. I don't want to detour you too much on this, but I just want you to know that SAMPS is dedicated to supporting the myeloma members, caregivers, and professionals. And we also support financially some very important research, I feel, that's being done locally here at the University of Calgary. I believe we're very efficient with our funds, and I think in the long run we're making quite an impact, but I really feel strongly, and hence that's why I'm involved. So tonight's event, typically we have these events at a hotel or a room somewhere, but we're pivoting to, during COVID times, to reaching out and providing our support. So for you visitors, please visit our website. And if you feel it's appropriate, please, I'd encourage you to sign up as being a members. Now, as far as tonight's meeting, I just want some housekeeping items to get taken care of. We will be recording this meeting, and there will be a link on the SAMPS website. So another good reason to go to our website, and you can click on that, and you can get any information that you maybe missed or would like to just confirm. Now, we will be having a question and answer session afterwards. So you can do this in two ways. As Dr. Lucier is giving the presentation, you at the bottom of the taskbar, there's a chat function. And when you click that, there's an area there you can type a question. Beverly Dunn, will be fielding those, and she will be taking note of those questions. And at the question and answer session, we will ask her to ask those questions, and Dr. Lucier will field them. If you would like to present your question in person, then we will ask you after Beverly is done in the question and answer. You can turn on your video and your audio, and you can ask the question personally. We would ask that you keep the questions fairly succinct and directed, and please try and avoid any sort of personal medical history that would go in there. These questions can get fairly convoluted at times, and we just want to keep the question and answers fairly directed. Now, after the question and answer, we will be having kind of a general meeting, and this is a very informal meeting, and I believe, Susan, you'll be helping us with that. And but anyways, we just want a general roundtable conversation, and just to see how people are doing, how they're, whether they're finding enough support, if there's any areas that they're needing help with, and how other attendees here can maybe help with their experiences. If you have any issues connecting, and like I say, I've got my very Amish sign here, but if you would like to connect with me during the presentation, please text me at this number, 403 rather, 804-0857. So anyways, if you want to take that down, you can connect with me directly. So that's basically it for me. If everybody can now turn off their video and their audio, Bev and I will keep ours on just so that Dr. Lucier has some feedback, and we'll go ahead with the presentation. And now I'm going to pass the baton over to Deet Adam, and he's going to introduce our speaker. I give you Dr. Lucier that way. Okay.
Thank you very much, Alan, for that great introduction. As he mentioned, this is our second Zoom network, and we're starting to really get enthused about getting into this technology. We have used it a fair bit with our board meetings, etc. But we're just getting now into having our network meetings this way. We have also now had confirmation from Dr. Bayless and Dr. Neary that they will make their annual presentation on January the 21st using Zoom. So we're looking forward to that. He'll update us on the latest development in myeloma research. We are currently now planning the future presentations for the next 6 months, so stay tuned. Tonight, we have Dr. Greg Lucier here to provide us with an insight to brain fog. And it's the second reason why I joined this meeting tonight. First one being as I was president. So I do have an interest in brain fog. Dr. Lucier is emeritus professor of neuroscience at the Cumming School of Medicine, University of Calgary. He has taught the brain fog program at Wellspring, Calgary for over 10 years. He's particularly interested in neuroplasticity and the development of techniques to improve memory and cognitive performance. Brain fog is the common term for changes in cognitive function that often result from cancer and its treatment. And many cancer patients experience decreased memory, shorter attention spans, more difficulty solving problems, and reduced ability to multitask. Wellspring's brain fog program, developed by Heather Palmer, provides education, enlightenment, and practical strategies for dealing with the challenging aspects of post-cancer brain change. I would like to introduce you to Dr. Greg Lucier, who will give us our presentation.
Thank you. Thank you, Deet. Good evening, everyone. Thank you for, I'm surprised people aren't out walking tonight in this balmy weather, now that we've had such a beautiful day. Thank you for taking time to come and hear me give you some information and some heads up about brain fog. I'm just going to go now and share my screen. And so what I'm going to talk about tonight is the awareness of brain fog, what constitutes what we're calling brain fog now, and also an overview of the brain fog program. So you should see now a slide that says brain fog awareness and program overview, right? Alan?
Yep.
Yeah, okay.
Sorry, yes, we're fine,
Okay.
sorry.
Yeah, thank you. So you'll notice here that the little square here at the bottom says maximum capacity, strategies for cognitive enhancement. And as Deet mentioned, the actual person who is the author of the program is Dr. Heather Palmer. and Maximum Capacity is her company based in Toronto. Heather is a psychologist. Her area of expertise is in memory and memory function. And she was approached by Wellspring, Ontario, probably about 17 or 18 years ago now, to put together a program that would help members of Wellspring that were experiencing what at that time we were calling chemo brain. Because there was a lot of similarity between what cancer patients were calling chemo brain and memory loss and some forms of early onset dementia, also people that had had brain injuries and their memory loss. Heather took the best of the psychological, sociological, and neurophysiological literature at the time and put it together and formed this 8-week program. And over the years, the program has evolved. And as mentioned, I've been offering the program at Wellspring, Calgary now for well over 10 years. So it was originally called chemo brain or chemo fog. And I can remember many years ago when my wife was going through her first round of cancer, and she was receiving chemo treatments, and I would go in with her to the Tom Baker and sit in the big chairs as she would get hooked up to her chemo. And one of the ladies would come in and say, you know, I went to go to my sister's house the other day and I got lost, and she's lived in the same place for 10 years. And the ladies would just laugh and say, oh, ho, ho, you've got chemo brain, you've got chemo brain. And so it was originally named and discovered by the cancer patients themselves. And they were going to their oncologists and they were saying, you know, there's something happening between me and the chemo treatment, because I find that I can't remember things as well. I can't multitask like I used to. I'm having a lot of difficulty, and I think it's the chemo. And the oncologist would say, well, I don't think it's the chemo. I don't really think it's the chemo. And the reason that they would say that was because when you receive the chemo in the bloodstream and it travels throughout the bloodstream, there's a barrier between the bloodstream and the brain, and it's called the blood-brain barrier. And the molecules of the chemotherapy were much too large to cross that barrier. So in actual fact, the oncologists were right in what they were saying. They just couldn't imagine how the large molecules of the chemotherapy chemicals were getting across and getting into the brain and affecting the brain. So that was probably now about 10, 15 years ago. About 8 years ago, what we found out was that, first of all, not everyone that got chemo brain. Many patients had large doses and prolonged doses of chemo, didn't experience any chemo brain at all. The other thing that was happening was symptoms similar to chemo brain were showing up in post-traumatic stress people, in ladies that are suffering postpartum, in people that had even quadruple bypass surgery. So it was looking more and more like what we were calling chemo brain was really due to some type of large physiological onslaught onto the nervous system, onto the human nervous system. So consequently, now we've changed the name and we call it brain fog. Likewise, the National Institutes of Health in Bethesda in the States actually about probably 8 or 9 years ago decided to actually call it brain fog and actually fund research in that area. So we don't call it chemo brain anymore. It's called brain fog. And you'll also notice, if you've been following obviously the press and things that have been going on with COVID, now people are talking about COVID fog. Right? So what it's turning out to be is as I said, it seems to be due to a large physiological onslaught onto the nervous system causes many of the symptoms we call brain fog. And what are they? Well, they include, as listed here, memory changes, verbal skills, lack of attention and concentration, executive functions. And by executive functions, we mean sort of planning things, right? Where you're planning a trip or planning a list or things like that. Motor function, which could be movement and coordination. Some people experience, they're just a little bit more clumsy. You tend to bump into things more often, or you try to reach for something, you maybe knock over a saucer or a glass of water. Spatial skills, that is the orientation in space, and this would be our lady that got lost going to her sister's. And mood and psychological well-being. But in the case of mood and psychological well-being, usually the mood changes and the psychological well-being changes are the result of having difficulty with memory and verbal skills and attention concentration. So most of the people, when I start a class, normally at Wellspring, we go around the table and I ask people to say, to the extent that they feel comfortable, why are they there? What are they experiencing? The big three are always memory problems, verbal skills, and attention and concentration, and sometimes executive function. Not so much motor, not so much spatial. So what causes the changes? Is it the chemotherapy? Well, probably not, because we know now that you can get brain fog without having chemotherapy, and you can have chemotherapy and not necessarily have brain fog. The difficulty with, well, let me just go on to the rest of the things. Is it the cancer? Could it be the cancer? Well, it seems to be across the board, many different types of cancer. People experience it irrespective of the type of cancer. Is it the cancer-related treatments? And that means, is it the other related treatments? And I'll elaborate on that in a minute. Is there a genetic predisposition? We don't seem to see any, there's no indication that there's a genetic predisposition. There's no, and I'll also answer this question right now because a lot of people often ask it. Well, if I have brain fog, does that mean I'm going to have early senile dementia when I'm older? No, there's no correlation there. Is it the psychosocial constructs? Could be. A lot of people, you are all aware, some people suffer more with their cancer experience than others. But again, there's not that great a correlation. The problem with it is that it is recognized now. So the one thing that I always tell the brain fog, people taking the brain fog program, it's recognized worldwide. It's recognized in the medical literature. You now can do medical searches, whether you go on PubMed or Medline or any of these things. You should not have, as we did probably 15 years ago, any physician or anyone in the cancer business say, oh, well, it's all in your head, right? You may have a significant other or a family member say, oh, well, you know, we're all getting older. We all forget things. Well, yeah, but try telling that to an 18-year-old or a 20-year-old that I've had in my class. No, it is a definite thing. Brain fog is real. After a period of time, it starts to go away. But the idea behind the program is to learn to provide you with tips and techniques that you can use to counteract the brain fog. Now, what makes it so difficult to research? You could say, well, you know what, if they can come up with a vaccine for COVID within 3 or 4 months, why can't they find something to counteract brain fog? Well, from the cancer point of view, the problem is that everybody's cancer is different. Everybody is different. We like to think, you know, when I taught medical students for over 50 years, and we teach medical students on the basis that everybody's a Ford. And so if somebody comes in and they're hiccuping and they're doing this and that, you tweak the carburetor just like you would on a Ford, because you know all Fords are the same. But the problem is that all people are not the same, right? Alan might be a Renault, and Beverly may be a Honda, and Deet may be a Volkswagen, right? So we're all different. We're all different, right? So, and our cancer is different, and our cancer treatment is different. So in order to find out more about cancer-related brain fog, we have to look at literally thousands and thousands and thousands of people and try and get, 500 ladies that all have stage 3 breast cancer, that are this age, that have had this many children or whatever. And you only do that by pooling information and doing what's called a meta-analysis, pooling information from all over the world, from the MD Anderson Center, from the Tom Baker Center, from the Cross Cancer Center, to crunch all of these numbers to see what the similarities and differences are to try and do this. And now the research is coming along, but oncologists don't have time to do this. You have to have people that are medically trained, but also are computer and statistically trained to do this. So people are looking into the causes of brain fog, but we still are a long way from knowing exactly what causes it. Cancer-related brain fog is one of the primary concern identified by cancer patients worldwide. Again, as it says here, the symptoms are variable, as I've said. Severity and duration of condition is variable. Some people experience it for maybe 1 or 2 years. I think in my wife's case, she said that it was about 5 years from the time that she went through her chemo and felt that she was back 100%. So it varies from individual to individual. Assessment tools may not necessarily detect it. You can't necessarily give people psychological tests and definitely show that they have it. It's more something that the individual knows themselves that they have. There is scientific evidence of neurophysiological changes caused by some aspects of the disease. When you actually look into the brains of patients that are suffering from brain fog, we do see certain areas of the brain change and light up, and we talk about that during the class and the programs. But we still don't know, it's not always the same for each individual, as I said, because we're not all Fords. Even subtle cognitive difficulties can have a big impact, though, on the quality of life, right? And so many people, we have a program at Wellspring, a back to work program. And often I see a lot of people, they'll take the brain fog program because they're getting ready to go back to work. And they're having difficulty remembering, and they're having difficulty multitasking. And so they take the brain fog program to learn the tricks and techniques that Heather's put together to be able to minimize the effects of brain fog. As far as brain fog goes, I've had young people, 17, 18. I've had people in their 80s. I've had judges, lawyers, teachers, physicians. There's no correlation between, how many people. It's not like, well, if you used your brain a lot, you have a greater tendency to get brain fog. Sorry, it just doesn't work that way. So the strategies in the brain fog program, Heather has put together sort of a multi-dimensional approach. And the series is evidence-based in the sense that she's taken the best from the psychological, the sociological, the teaching, and the neurophysiological literature to put the program together. And we work on 3 particular things in the program. First of all, memory skills. About 3 weeks, the program is an 8-week program, so we work on memory skills for about 3 weeks. Then we work on, task management, which is multitasking, right? And then psychological well-being. And these are the 3 pillars that Heather's put together on which optimal cognition is built. Now, we do know, which we didn't know, when I first started teaching medical students many, many, many years ago, we used to think that if you lost a certain part of your brain, you could not retrieve it, right? There was no such thing as what we now call neuroplasticity. And just to give you just a quick explanation of what I'm talking about when I talk about neuroplasticity. We always knew that there were literally billions of gray cells or neurons in the brain that we didn't know what they did. They just sort of seemed to sit around there. They were extra, and we didn't know what they did. But we knew there were certain areas of the brain that were associated with memory, certain areas of the brain associated with vision, certain areas of the brain associated with speech, all that sort of thing. And we thought in the early days that if you lost an area of the brain, either through a blood clot, shutting off blood supply to that area of the brain, or if a 9mm bullet went through your brain, whatever it was that knocked out an area of the brain, then that was gone forever. But we now know that that's not necessarily the case. Things and memories and very many neural functions are really spread out through varying areas of the brain. So you can recover from these things, and new neurons, new brain cells, or those ones that have been sitting around twiddling their thumbs for maybe 30 or 40 years, can take over the role that other neurons were playing. And this is the idea behind, I'm sure if many of you or may not be familiar with the Congresswoman in the United States, Gifford, who was shot with a 9mm bullet and lost speech and movement and all those things. And each time you see her speak and get on the podium, she's getting better and better and better, because new areas of the brain are taking over those old areas. So that's what we call when we call neuroplasticity. And that's exactly how we learn too, because we use certain neurons to form connections, to remember something, and these create new connections, and the repetitive activity goes around and around and around and strengthens it and builds this. And we elaborate a little bit on this in the program. But think about it this way. Think about trying to learn a poem, right? You start off by learning a few lines, and then you kind of forget, and then you learn a few more lines, and the next thing you know, you've got 25 of the 400 lines or whatever. It gradually, because you're building and you're building and you're building up. And that's the idea behind neuroplasticity and learning and having new memory traces and new connections laid down in the brain. So memory skills, we talk a lot about memory skills. Memory skills teaches a number of effective strategies and techniques that can be used to enhance memory. Systematically, individuals identify the combination or techniques and the strategies that works best for them given their cognitive challenges and life circumstances. So what are some of these things that we do that we talk about? External strategies is one. Here's an old school external strategy. She says, is your memory really that bad? And he said, yes, I back everything up on my memory stick. So he's used all of those Post-it notes on his cane, and that's his memory stick. That's an old school memory stick. But external strategies are important. Lists, calendars, timers, notes, all of these things. And often people will say, well, I never had to make a list before, I could remember it all. Or I never had to use Post-it notes before, I could remember it all. And now I do. And that's the idea behind the Brain Fog program. It's sort of like a cheat sheet. It's what you have to do now to be able to get through your day and remember to pick up that quart of milk on your way home, or to do things, or remember where you put your glasses, or where you put your keys, or where you put your teeth. It doesn't matter what it is. It's to remember these things without at the end of the night feeling embarrassed. And it doesn't, and this goes for, like I say, our young cancer members as well. So the idea behind it is to learn techniques that maybe you didn't have to use before, but you have to use now. And some of them here, one of them that I'll give you a thing is Post-it notes. Post-it notes are great. You know, you can write on Post-it notes, carry them with you, stick them on the dashboard. You get up in the morning and you're leaving, you're going someplace, you got to pick up milk. You think, oh, how will I ever remember to pick up the milk? You know, put it on a Post-it note and stick it on the dashboard of your car, stick it someplace so you remember it. Timers, use of timers. We always think we would never think of baking muffins or a cake or something without using a timer, right? But have you ever thought of, you know, you have to go to, well, like say tonight, you had to log on to the Zoom thing at 7 o'clock. So it's say 6 o'clock and you think, you know what, I'll get on my computer and I'll just check my email for a half an hour and then I'll go to the Zoom meeting, okay? So you get on your email and you're out there surfing and all those great cat videos show up and all these things and you're busy looking. And the next thing you know, it's 7:10 and you're late for the Zoom meeting. The idea behind a timer is you've got a timer on your iPad, you got a timer on your computer, you got a timer on your cell phone. You can buy a cheap timer. You set your timer for 20 minutes, you put it by your computer. Then when you log on, even if you get tied up with those great cat videos, it's going to go off and then you're going to say, oh, I got to leave to do this, or I've got to switch over to do that. Routines and habits, they save a lot of time. You always put your car keys in a certain place. You always, you have a habit of putting your glasses in a certain place, whatever. Planning and organization, things like that, where people often review the next day, the night before, or review the day first thing in the morning. When you get up, you're lying in bed, you think, oh yeah, today is Wednesday. Today's brain fog. I've got brain fog today. I have to log on and do brain fog. Oh, it's also blue card day. So I got to remember to put out the blue card or whatever it is. The other one is external self-talk. And the neat thing about external self-talk is that you can talk to yourself now. I usually ask people, but I can't see you all, so I won't. But I usually ask people at this point, how many of you talk to yourself, right? And a lot of people do. And it used to be really embarrassing because many, many years ago, as we all know, if you were walking down the street and somebody was coming in your direction and they were talking away a mile a minute, you kind of would sort of move off the sidewalk. But nowadays, because of cell phones and because of all these little things you can put in your ear, and because people are talking in their cars because they're really talking on their cell phones, you can talk to yourself wherever you want and nobody pays any attention to you. Used to be you have to talk to your cat or talk to your dog or talk to something so you would feel good about yourself. Now you can talk wherever you want. If you're walking down the street talking to yourself and people don't see that you're on your phone, they'll probably just pass by you and think, oh, well, he must have one of these new super phones or something. It's really in his ear and I can't see it. But the idea behind self-talk is it allows you to verbalize. You can't talk as fast as you can think. Some people try, but you can't. And the thing about it is in saying it, in rehearsing it and saying it. That's why if you're learning a poem or learning lines to a play, externally talking to yourself. And what I tell people during the course is the more modalities of sensation you can use when you're trying to learn something or remember something, the more you're apt to remember it. So for example, if you were to say to yourself, I'm going downstairs to get a loaf of bread out of the freezer, a can of beans out of the pantry, and a bottle of wine out of the cantina. If you could see me, what I'm doing is I'm putting each one of those things on a finger. So I'm seeing it, I'm saying it, and I'm associating it with a motor movement. So the more sensation, the more modalities of sensation you can use to try and remember something, the more you're apt to remember it. So these are the types of tricks and techniques that we talk about. Then we talk about internal strategies. Internal strategies are the ones that are just in your head, right? Chunking pieces of information into sensible categories. One of the things that we do is we learn to put things that you want to remember into categories. And the idea behind that is if you know the category, because you're an adult, it wouldn't work with a child, but because you're an adult, you know all of the things that go into that category. We play a little game during the course where I pull 10 things out of a bag and I ask people to put them into a category. Think about putting them into categories. And then after I pull the 10 things out of the bag, they have to write down the 10 things. So the way it would work would be like this. I pull 10 things out of the bag, but 3 of them are office things, 3 of them are gardening things, 3 of them are art things, for example. Well, the person that's trying to remember them may think, oh, well, I know there were gardening things. So what was it? Did he pull out a hose? No. Did he pull out a rake? Yeah, he had a little rake. Did he pull out seeds? Yeah, he pulled out seeds. Did he pull out a shovel? No. Did he pull out a flower pot? Yes. That's the idea. See, you know what goes into that category. So you can go through the things in the category. It's like when you make a grocery list and you leave the grocery list at home or in the car, and you go in and you stand in front of the dairy section. You know that you had to get 3 things in the dairy section. You can look at it and you can say, was it eggs? No, it wasn't eggs. Was it milk? Yeah, it was milk. Was it yogurt? No, it wasn't yogurt. So that's the way it works. Was it ice cream? Yeah, ice cream was one of the things. So that's by putting things into categories helps you remember things. Story making, another one, it helps you remember things. Story making goes with rhyming, okay? On old Olympus topmost top, a Finn and Dutchman viewed a hop. That's the mnemonic to remember the 12 pairs of cranial nerves. That's how medical students remember it. The idea behind 1492, Columbus sailed the ocean blue. You get a new PIN number, you get a new phone number, you make up a rhyme. I live in a house with 6 people, 2 cats and 1 dog, or whatever it is, to remember things. So, and the advantage of story making or rhyming is, of all of the different techniques, it's the only one that's linear. So you can remember things in order. There's no sense in remembering that your pin has a 6 in it and an 8 in it and a 2 in it and a 4 in it if you don't know the order that it comes in, because it's going to spit you out long before you get to. There's so many permutations and combinations. We talk about visual imagery. We all know people that'll say, I'm not really sure, but if I can see it, I can remember it. Or I remember going to that restaurant. I remember there was a gas station on the corner. It's recreating things visually. Association. Association is the technique where you remember things because it's something that's so ingrained in your memory that you're not going to forget. It's like when you meet somebody and they say, my name is Susan. And you think, oh, well, that's easy. My sister's name is Susan. So I'll remember her name for sure. Motor movement is engaging in a motion or a motor activity to try and remember something that you want to remember, associating it with something that you move. And spaced retrieval is the old technique that you rehearse something, you wait a day, you go back, you try and say it again, you go back, you review it. We've all used that to learn a new language, to learn lines to a play, to learn a poem. The neat thing about this is we talk about these external strategies. We talk and we practice the external strategies. We don't say, oh, you got to do this or you got to do that. What I usually find is that by week 6 of the program, people are coming back and they're saying, you know what? I'm more of a association categorization person. That's the way my brain works. We let you try different techniques and your brain will pick the ones that it likes the best. Task management focuses on a 4-step process for approaching both large and small daily tasks. And for that, we learn a new mantra: stop, clarify, simplify, monitor. How often does it happen to us that what we'll do is we'll, phone will ring and somebody will say, can you, it's your sister says, can you meet me at Market Mall on Thursday? I'm coming in to Calgary and let's meet at Market Mall and have lunch. And you say, oh yeah, okay, great. Let's do that. Let's do lunch at 11 o'clock at Market Mall. You hang up. A couple of things happen. First of all, you look on the calendar and you find out that you're booked for something else that day. The next thing is that you didn't know where you're going to meet her. You're going to meet her at the Sport Check end, or you're going to meet her at the Hudson Bay end. It's this sort of thing. It's learning how to stop and live in the present moment. What am I supposed to be doing? Stopping and clarifying, right? That's the best way to stay on task. You want me to do something. You want me to bake a dozen cookies for the Boy Scouts for Friday. Okay. Did they have peanut allergies? Do I take the cookies? Where do I take the cookies? Or is somebody going to pick up the cookies? that sort of thing. And simplifying when you're starting a small task or a large task. Often it's trying to get people to help you. For example, if one of the large tasks may be cleaning out your basement. You wanted to clean out your basement for the last 10 years. Your kids' hockey stuff is still down there and they have dumbbells, and now they're married and they got kids of their own. You go down to your basement step, you stand on the step and you look around the basement, you think, oh, it's dark down here, it's cold, I don't want to do this. And Bobby's stuff is still here, and you go back up and lie down until you feel better, right? The idea behind tackling a big task is you make a list. Maybe the first thing you do is you make it fun. Well, if the first thing you do is you look through your week and say, the basement's been like that for 10 years. Where can I get 2 hours a week for the next X number of weeks to clean up the basement? So you learn to you make a schedule, you make a list. First thing I got to do, take a light down there, maybe take a radio down there, go to the liquor store and pick up some empty boxes because I know I got to go through boxes. Call up Billy and say, you know what, if you don't come and get your dumbbells out by the end of next week, I'm going to assume you don't want them anymore and I'm going to cart them off someplace else. So that's this idea of stop, clarify, simplify, and then monitor. Example, February, you're going through your desk, you got to get rid of all of those old bills from last year because the new ones are coming in. You decide, oh, you know what, I'm going to gather up all my old receipts. I'm going to organize them, put them in a box and put them downstairs, make room in my desk for the new bills and the new things for 2021. You go into the kitchen to get a rubber band because you want to put a rubber band around those things. Then you pull out the rubber band drawer. And then you find out, oh, if your rubber band drawer looks like my rubber band drawer, you start organizing the rubber band drawer. You got all kinds of stuff in there. There's spoons, there's candles, there's birthday candles, there's greetings, there's everything. And you start doing that. Then after about an hour, you forget, oh, why did I really even come in here? You didn't monitor, right? You got sidetracked. Stop, clarify, simplify, and monitor. Am I still on the task? So stopping is to take a deep breath, bring your mind into the present state, as it says here. It may be a phrase that you say to yourself, or it may be something, a motor movement that you do, something to trigger your brain to pay attention. Clarify what the goal is. What is my plan? Simplify it. Do I need help? How can I do it in a simple way? And then once I start it, monitor it. Stop, clarify, simplify, monitor. Psychological well-being is what we tackle and talk about at the end. And it's, as I said, usually people are not very happy about what they're doing because they're having trouble with memory and they're having trouble multitasking and they're having difficulties doing things that they used to be able to do. And it's difficult for them to do those things now. The idea behind the whole brain fog program, as I said, is to get people out and doing things. Because what happens is a lot of people say, well, you know, I used to like to play bridge, but I don't anymore because I can't follow the suits. Or, you know, we used to entertain a lot, you know, this is pre-COVID, okay? Used to go out and entertain a lot. Now when I go out, by the time I'm introduced to the third person, I can't remember the name of the first person. So that's why all of these ideas is to get people to get out and start and use their brain, start and use their memory, start and use these techniques. Psychological well-being is the way a person feels about themselves, others, and their environment. Includes constructs such as happiness, self-efficacy, coping, optimism, and feelings of control. Control refers to taking charge of your life. Self-efficacy is getting the result that you want. Lifestyle and activities, maintaining independence and satisfaction with daily activities. And it's a cheat sheet, right? I mean, if you used to be able to remember your shopping list, good for you. But if you can't remember it anymore, well, then you start to make lists or you start to use Post-it notes. Or you know what, if you go out and you meet 3 people and you can't remember their names, you write their name on the palm of your hand, or you go in, you excuse yourself, go in the washroom and then write the name on the palm of your hand. The idea of it is at the end of the night, you can remember the name rather than say, well, I won't go anymore because I'm going to be embarrassed because I can't remember the person's name. So it's a way of coping in a response to positive and negative situations, and also optimism, looking on the positive side of things. Happiness. We talk a little bit about happiness. Happiness is very subjective. In this case, happiness is a warm puppy. But we all think there's a big difference between well-being and happiness, and what happiness is. So we talk a lot about happiness. We talk a lot about napping. Napping. Everybody's afraid to nap. Napping is bad. Like you're a bum if you nap, right? Well, the thing about it is that napping is really important, particularly when you're in a healing mode, particularly when you're trying to learn something, particularly when you're trying to lay down new memory engrams and remember things. So napping, we talk a little bit about napping. Some people that were great nappers, Churchill, Einstein, how long you should nap, when you should nap. You don't want to nap all afternoon, so you're up till 4 o'clock in the morning, then you easily get your days and nights completely reversed, right? And then a little bit about energy vampires. Energy vampires are people that just suck the energy right out of you, right? And this is the thing about, when you're in a healing mode and you're trying to heal and you're trying to recover, the last thing you want is people that are going to suck the life out of you, right? You want cheerleaders. You want people that are going to make you feel good, that are going to help you, that are going to be beneficial. And we all know these people. You get up in the morning, like today, it was a great morning, right? It was a beautiful day. It's 14 degrees. It's nice. There's no snow to shovel, and you go out. And then you meet somebody, or your best friend, or somebody calls you and says, oh, well, the COVID numbers are going up, and I heard that, things are going to be really bad, and they're looking at the Olympic Center to put a bunch of beds in there because everybody's going to have COVID in 2 months, and it's going to be blah, blah, blah. And you hang up the phone, and then you just don't feel good anymore, right? Because that individual's just sucked the life right and the happiness right out of you. And so that's another thing. You want to learn to spot these energy vampires to be able to counteract it. And it may mean breaking up with somebody, friendships or whatever, or it may, whatever. We just talk about it. Usually the people in the course have more ideas than I have about that. People either inspire you or they drain you, and you have to pick them wisely, right? So that's the brain fog program in a quick overview, sort of nutshell type thing. It's 8 weeks. Wellspring. Let me just go back. Let me go back to there. So I'm back on the home turf. Wellspring actually pays maximum capacity for the rights to deliver the program. So if you're a Wellspring member, and of course there's no charge for any of the programs at Wellspring, you get the brain fog program free. As I said, I've been running the program now for over 10 years. I've had all kinds of individuals with all kinds of cancers, and young people and older people, and from every walk of life. I have to say, I have to say that I've never, in all the time that I've delivered the program, have I had anybody come to me and say, this is the worst piece of crap that I've ever experienced. I just wasted 8 weeks. And that was when they used to have to drive to the Wellspring to get it. And usually, often, I'll have either a significant other or a son or a daughter, because sometimes people that come to the program, this is when I was delivering the program at Randy O'Dell House or at Karma House, someone would come with the member. And I've had them come up to me and say, holy mackerel, I wish I knew these techniques when I was at university. These are so neat. I was using these and I'm using them myself, and I don't even have brain fog. I just finished a program. I just gave the last class, class 8, yesterday, of the brain fog program. And the response was, I had one lady at class number 6 say, I can't tell you how much this program has helped me. That I feel so much better now about going out and doing things, and I've learned the tricks and techniques. So I think the advantage of it now is we've kind of got it down to a system. you can do it in the comfort of your own home. Now, you don't even have to go to Karma House or Randy O'Dell House. You can log on via Zoom. You get the handouts and the program mailed to you in a plain brown envelope, so people will never even know what you're taking. And you have that to go through and look at. So I would encourage you to check out. I would encourage you to check out any or all of the programs at Wellspring. And I would certainly, if you feel that you're having difficulty remembering, if you're having difficulty multitasking, if you're tending not to do things because of that, then I would strongly advise you to take the brain fog program. It really is one of our best, one of our core programs. And I'm not the only person that delivers it at Wellspring. So we usually run a couple of them at a time. I think the next time we'll be running the program is in February or March. You can log on to the Wellspring site and see when the next program's coming up. So I think with that, I'm gonna be quiet and answer questions if I can.
Thanks, Dr. Lucier. That was very informative, I thought, a great presentation, and going in, I thought it was going to be more related to patients, but I think this is a general course that almost anybody could benefit from. So I, sure opened my eyes to the, what can be done and the tips and tricks that way. So I hope everybody got something out of tonight's presentation. At this moment, I'll pass things off to Bev. I'm not sure if anybody's submitted any chat questions, but let's see what Bev has to say.
There's just one chat question, Alan, and it was wondering if there are any supplements like vitamins or minerals or oils that somebody could take to offset the effects of brain fog if you're undergoing chemo?
Well, it's interesting, and we talk a lot about the things that affect learning and the things that affect memory, right? And one of them is fatigue. Let me backtrack a little bit. Since we don't have any other questions, maybe this will stimulate some questions. One of the first things we do is I pass out, there's a handout in the first class, and people log their slips during the week. So we say, every time you have a memory slip, or every time you get lost in multitasking or whatever, write it down. Keep a log for a week. And generally what people find is that they do poorly when they're tired, right? That's one thing. They do poorly when they're in pain, because pain is the one modality of sensation that takes, of course, center stage. Any of you that have suffered chronic or acute pain, or certainly headaches and different, if you're in pain, you're not paying attention to anything, and your brain's not paying any attention to anything. So one is fatigue, one is pain. Nutrition is not so much a problem in North America. I mean, I think if you eat a good, well-balanced diet, there's nothing that I'm aware of in the literature that you can take that is going to make you remember things more if you have brain fog, or that's going to help you in multitasking if you have brain fog. There's other than a good, well-balanced diet. That's about it. Sorry, I wish there was. We're all looking for something like that. It used to be, they used to say fish was good brain food, because when you open a fish and it was white and it was kind of fluffy, it looked like the brain. We had that association in olden times, right? If something looked like the brain, it was good for your brain. If something looked like your liver, it was good for your liver. But that's just wishful thinking, right?
Well, and there have been a couple of more questions pop up here. The first one was, is there a cost associated to registering for the program?
No. Oh, sorry. I'm sorry. I jumped in and answered that too quick. You have another two-part question? Yeah.
No, well, the one question was, is there a cost associated to us for registering with with the program?
No. Wellspring, Calgary, and Wellspring, Wellspring period, whether it's Edmonton or Calgary, or whether it's Ontario or wherever it is in Canada, Wellspring is, there's no charge for any of the programs. All you have to do is come. We like you to sign up and become a member of Wellspring, but there's no charge to be a member, and then there's no charge to take any of the programs.
Oh, great.
Except if you want to take ukulele, I think you got to buy your own ukulele. But other than that, I don't know.
Well, that sounds fun, actually. And the other question was, is feeling lightheaded a symptom of brain fog? Or is that something, could be something else?
That could probably be something else. And one of the questions, and that's interesting because that goes back to what we said about charting the things during the week, because what some people find is some medications they're on, and a lot of people are on different medications, were on medication even before their cancer. So it's a lot of it, when you write it down, you tend to see something. You may see something there that you don't really realize is that, okay, you know what? Every time I take this medication, 4 hours later, I feel lightheaded, but you don't associate with it until you write it down and chart it you know what I mean? So, but it's not lightheadedness is not one of the components of brain fog, but certainly it could be a component of either a treatment of part of the regimen of treatment. Yeah.
Okay, great. Thank you. And those are all the questions in the chat room. So we'll turn it over to back to Alan.
Okay. Oh, sorry. Somebody's got a hand up. Yeah, I see.
Yeah.
I see a hand.
Hi, it's Linda Pritchard.
Yes, Linda. Hi, Brian. Nice to see you again. I haven't seen you for a long time.
Yeah, yes. Good presentation.
Thank you, Brian. Thank you. So nice to see you. I'm sorry, Linda. I just had to interject in because I recognized Brian earlier and I had to say hi. I think the last time I saw him was at Wellspring.
But it's me in the spotlight here. I'm the patient.
Yes.
I had evaluation done because my brain fog was so frustrating to me. And it was determined that it was my intake brain that is suffering. Because I'm on constant chemo with the myeloma, is that likely to ever improve?
I can't answer that right offhand because of the fact that I know there are some drugs that symptoms that are similar to brain fog are part of the side effects of those drugs.
Okay.
And as long as you're on that drug, you're going to have that effect, just like some drugs you read on the label, constipation or blurred vision or whatever it is. Yeah. So it could very well be. I can't answer that question without knowing, the drugs, the doses and what it says about that. But I would say though, it's still worthwhile, I think, to take the program and learn the tricks and techniques because they definitely do help a lot. And I wouldn't rule it out. And, what the heck, it's free and we have a lot of fun and you're going to meet a lot of people.
I will be an advocate for Wellspring. I've been attending programs for 5 years.
Yes.
Love it there. Any of my art programs, my exercise and educate, my meditation, all of that has really helped or enhanced my life, helped my brain, my memory, the exercise, the patterning of the exercises and whatnot has all helped. But it's just still so frustrating with the intake brain. So I just wondered if there was anything that you knew about the intake brain that can be improved. But yeah, I've signed up for the course for, I think it starts March 3rd.
Oh, wonderful. Okay.
Yeah.
Yeah. So that'll either be me or, well, yeah.
I
I've got
think
brain
it
fog.
said you were in the program flyer, but
Oh, good. Yeah. Well, that'll be
yeah.
great. No, I mean, I think it's worthwhile. It's hard to say, you know, how different people get different things out of the program. That's the other thing. As I said, the idea behind the program, we don't push categorization, or we don't push visualization, or we don't, because I'm a very strong believer in, you know, everybody is different, and certain people get certain things out of the program. And you may find that, you know, just a couple of the things in the program might be just what you need to enhance your cognitive ability, enhance what your memory, and enhance what you're doing. You know, you just don't know until you try it, really. Yeah.
Thank you.
Oh, you're welcome. You're welcome.
Very good. Any more questions that people would like to pose to Dr. Lucier?
I just want to make a comment about just a general comment about Wellspring, and about when Linda's already said the commercial there. I think that the thing about it is, the difference is that you know, it's not, we try and make, the idea behind Wellspring is to make everybody's day better. We're not into heavy psychological, psychosocial sorts of things, right? So, I mean, I've had people come in for brain fog, maybe a couple over the 10 years that I've deemed are really, really in difficult psychological straits. And the first thing I do is recommend them to go over to psychosocial services. I mean, we try to make this fun, right? These are tricks and techniques and ideas to help improve your memory and help you improve your ability to multitask, help you feel better about yourself, so that in pre-COVID, we used to say, so people would go out and still try and get back to their normal life as much as they possibly could. And that was the philosophy behind brain fog in the first place. It was started by 3 cancer survivors who, you know, were kicked out of the program at the end. Of Tom Baker, here's your card, goodbye, thank you very much, don't come back for 6 months. And then you say, well, now what do I do, right? What do I do? How do I put my life back together again? So that was part of the whole idea of Wellspring. So these are things that are there to help you, and have fun at the same time. And hey, they're free. So what more can you ask, right? Sorry, I won't interrupt again, Alan. Go ahead.
No, that's no problem.
Hello. I have 2 questions, if
Yes.
if you don't mind.
Sure.
So
Certainly.
thank you very much for the very informative presentation. My name is Amir. The name on the, you know, the screen is my wife. So the question is, for the people that they are doubtful about they have a brain foggy or not, is there any initial assessment to start with? So, for example, myself, I was not very good. I had no very good memory even before the, you know, diagnosis. But I feel that sometimes I have an issue and concern, but I have a doubt that I have brain fog or something impacted from the chemotherapy initially, and we turn to some other, you know, immunotherapies. This is the second question that I have, is that the new treatments which are more focused on the immunotherapy, do they have a less impact of this type of issues or not? Thank you very much.
Thank you. Yeah. Okay. So to answer the first part of the question, maybe first, it's very, there isn't, I think it said in one of the slides, it's very, very difficult to diagnose brain fog in that sense. It's not something that just sticks out all the time. So it's not like you can come into Wellspring or any place and sit down and they can give you a battery of psychological tests and necessarily say that you're suffering from brain fog, right? Usually it's the people themselves that know it, and it's subtle things like I forget my keys, or I forget to go here, I forget to go there. So that's one thing. However, what we do, one of the interesting things is that when you come in and when you come in and do the first class, we give you a questionnaire to fill out, 31 questions. You know, I lose my keys rarely, very similar, some often, not often, I forget to go here or there. We have people fill that out and they score it. They get a number, they get an actual number, like say 85. Then you take the 8 brain fog classes and we give you the questionnaire again and you score the questionnaire. I find that I'm doing it less often, more. Inevitably, most people score less after the 8 weeks, which means their memory has improved, right? That their ability to multitask has improved, but it's on subtle things and they're the only ones that can tell. They know it. To answer your question about the new treatments, I haven't seen anything in the literature as yet. As you know, these are new drugs, and there just hasn't been, that I know of, enough research. But that's a good point. Whether they are less apt to cause brain fog than other therapies, I can't answer that. I don't know. Maybe somebody is doing research on it, and it's a good question, and it's something that I would certainly ask Dr. Palmer, because she keeps up on all of this all the time. But I'm not aware of that right now.
Very good. Any other questions that people would like to send out to Dr. Lucier? So if there aren't any more, I'll end the formal presentation right now by Dr. Lucier. I'll likely end the recording shortly here. I just want to say I may have sort of leaped before I looked here as far as, so the next part of the presentation is probably not going to be a sort of a round table or a conversation. I'm just going to ask some folks for any feedback and any suggestions for future programs.
Okay.
But at this point, I'd just like to thank Dr. Lucier for this very insightful presentation. Like I say, I think it's helpful for almost anybody. It was engaging, very down to earth, very personable, and we are very, very thankful that you were able to come back after that false start last year.
No problem. And thank you very much for inviting me. It's been a pleasure to meet you all. And hopefully I'll see you either in the brain fog program or sometime at Wellspring when we're up and running in the bricks and mortar building. So thank you very much. I'm going to leave your meeting now and leave you to it. So thank you and good evening.
Thank
Bye
you.
now.
Thank you.
Bye-bye.
Thank you very much.
Thank you.